Hello, good afternoon everyone. My name is Dr. Samarth. I'm a consultant diabetologist working in Downhill. Today we will learn about heart diseases in women. Heart disease in women is a common entity where everyone should be knowing regarding this concept. So today we will talk regarding heart diseases in women. In today's session, we will discuss about heart disease in women, its causes, its preventive measures needed to avoid heart attack. The term heart disease refers to several types of heart conditions, including coronary artery disease and heart attack. Despite increases in awareness over the past decade, only half, that is only 56% of women recognize that the heart disease is their number one cause of mortality. Women's experience with heart disease is different from men in several important ways. Women are underaware and are under-researched. Women's unique physiology poses distinct challenges in the prevention and management of the heart disease. Heart disease that affect women more than men are majorly of there are of two types. That first type, that is MVD, called as coronary microvascular disease, a problem that affects the heart's tiny arteries. And second thing is broken heart syndrome, extreme emotional stress leading to severe but often short-term fatigueness of the muscles. The older a woman gets, the more likely she is to get a heart disease. But women of all ages should be concerned about the heart disease. Coming to the heart attack symptoms for women, what are the symptomatology that everyone should know? It's never too early to see a doctor to discuss your risk for heart disease. In fact, the new primary prevention guidelines say that the earlier the risk factor for heart disease and they are better prevented and are better treated, the less likely you are to develop heart disease later in life. The most common heart attack symptom in women is same as in men. Same type of chest pain, pressure, discomfort that lasts for more than few minutes or hours, but chest pain is not always severe or even the most noticeable symptom, particularly in women. Women often describe it as a pressure or tightness, and it's possibly to have a heart attack without chest pain. Women are more likely than men to have a heart attack symptoms unrelated to chest pain, such as it can be neck or jaw pain, shoulder or upper back or abdominal discomfort, shortness of breath, pain in one or both arms, nausea or vomiting, sweating, lightheadedness or dizziness, unusual fatigue, and indigestion. Let's discuss the risk factors for cardiovascular disease that are unique to the woman. One that is first is gestational hypertension. Having blood pressure during pregnancy increases the risk of having CVD and high blood pressure later in life. The risk of serious blood pressure related complications with a future pregnancy also is increased. Second is preeclampsia. This disorder can occur during pregnancy or after childbirth. If it is not diagnosed and treated, it can lead to serious health problems. Women who have had preeclampsia are at a greater risk of developing CVD. Third is gestational diabetes. Diabetes that first appears during pregnancy increases the risk of developing diabetes and CVD after pregnancy. Women who have gestational diabetes should be tested for diabetes 6 to 12 weeks after childbirth and then after every 3 years. Next, fourth is PCOS, that is polycystic ovarian syndrome. PCOS is a leading cause of infertility that can affect all areas of the body, not just the reproductive system. Having PCOS increases the risk of diabetes and may increase the risk of CVD. Certain autoimmune disorders, diseases such as lupus or rheumatoid arthritis, which are more common in women, are associated with increased risk of CVD. Screening for CVD is recommended for women with these disorders. Hormonal birth control methods. Women using oral contraceptive pills have a small increased risk of stroke compared with non-users. The risk is higher for women aged 35 years and older who smoke, women with additional risk factors for stroke, or who have high blood pressure, and women who have migraine headache. Thus, oral contraceptive pills are not recommended for women with these risk factors. Now, we will discuss the association between menopause and heart disease. Menopause is a normal stage in women's life. It's the change a woman feels either before or after she stops having her period. It usually happens between the ages of 45 and 55. Menopause can causes changes in the hormonal levels. It also brings other physical changes like hot flashes, night sweats, emotional changes, dryness in the vagina. The change of natural hormonal levels as women get older may play a part in the higher risk of heart diseases after menopause. Coming to treatment of heart disease in women. In general, heart disease treatment in women and in men is similar. It can include medication, angioplasty and stenting, or coronary bypass surgery. Angioplasty and stenting, commonly used treatment for heart attack, work for both men and women. But for coronary bypass surgery, women are more likely than men to have complications. Cardiac rehabilitation can improve health and aid recovery from the heart disease. However, women are less likely to be referred for cardiac rehabilitation than men are. Lastly, what can women do to reduce the risk of heart disease? Living a healthy lifestyle. First is quit smoking. If you don't smoke, don't start. Try to avoid exposure to secondhand smoke, which also can damage your blood vessels. And exercise regularly. In general, everybody should do moderate exercises such as walking and brisk walk on most days of the week. Maintain a healthy weight. Ask your doctor regarding the weight management. If you are overweight, losing a few pounds can lower your blood pressure and reduce the risk of diabetes. Eat a healthy diet. Opt for whole grains, a variety of fruits and vegetables, low fat and free dairy products. Manage your stress. Stress can cause your arteries to tighten, which can increase your risk of heart disease, particularly coronary microvascular disease. Follow your treatment plan. Take your medications as prescribed, such as blood pressure medication, blood thinners, and aspirin. Manage other health conditions. High blood pressure, high cholesterol, and diabetes increases the risk of heart diseases. These are the major things I wanted to talk regarding understanding the heart disease in women. So I conclude my lecture by saying that everyone should take care of their heart, exercise regularly, and quit smoking. Thank you. Thank you, everyone.